Okay, so Tourette syndrome, it is a genetic neurological disorder that has been characterized by chronic motor as well as vocal dysfunctions. So it's called as tics, that is nothing but there will be rapid, sudden or recurrent and involuntary movements. So tics are of two types, that is either simple or complex. Simple is nothing but where only one group of muscles is being involved. Complex is where more than one group of muscles is involved, then we call it as complex tics. So when it is motor function is being affected, it will be calling eye darting or eye rolling, that is nystagmus is all, darting is nothing but shrugging, that is the shoulder movement will be abnormal, suddenly they will be doing that shoulder movements, and twitching, neck twitching, all those things. So this will start with motor function, it will first affect the neck, head and face. So these are the three organs which will be affected first, sorry, parts of the body. So these are the motor symptoms, and in vocal they will be causing grunting, that is like pig sounds. Pig will make some grunting sounds, right? So that will be the sound. Throat clearing, that is they'll be having something itching type sensation, so they'll be wanting to clear their throat. So they'll be doing when it starts like it's like called urging, so they start doing scratching, so that they'll try to suppress the tics. It's like they'll feel embarrassed in doing in front of all the people, so they try to suppress it. The more you suppress, it will be predominantly seen. Next, sucking sounds, like any blowing sounds or sucking sounds, like drinking sounds and all, they'll be making it frequently. And if it's complex, when motor is affected, it will cause touching others. They feel like touching others or touching themselves. They'll start hitting, then jumping unnecessarily. Then in vocal, where it is coprolalia, that is where they start using abusive words. Suddenly they'll be normal but start using abusive words. Palilalia, that is where they start repeating their own words. They like same word they'll be repeating again and again. Next is echolalia, that is trying to imitate others. Whatever the other person is saying, the same words they try to repeat. The causes for this is unknown. It is usually believed it is either because of any genetic disorders or because of environmental also they are developed. It's like when we see some person blinking their eyes for a long time, even we automatically feel like blinking our eyes. So this is like even environmental wise also they can be seen. When environmental factors are involved, it will be usually it will subside. Only in certain conditions, like it will usually start from 2 to 6 years of age, and once they cross 18 years of age, usually in 80% of the patients this disease will subside. Only in 20% people it will go to severe conditions. And even neurotransmitters such as dopamine and serotonin are also having some effect in Tourette syndrome. Pathophysiology, as I told, it is unknown. One of the main thing is basal ganglia. So basal ganglia major function is it will have a control on our motor functions. So basal ganglia will actually inhibit certain neurons in the thalamus, which is sending unwanted signals, that is no need to do any motor functions. Unwanted any signals is there, basal ganglia is necessary to inhibit those unwanted movements. But when this is being inhibited, involuntary actions will be seen and it will lead to Tourette syndrome. And even when dopamine level is high as well as serotonin level is low, I don't know, they have not shown what is the relation between dopamine and serotonin in this syndrome. It's just seen in post-mortem studies or in certain animal studies, there is like increased dopamine and decreased serotonin level. They're still they're doing research, how is it related, they're still finding it. The risk factors are whoever is having any family history, like if one parent is having, then definitely the child also will be having. It's like an autosomal disease, dominant disease. Then in compared to male and female, male are more dominant in having, it's like 3 to 4 times there are more occurrence in male. Complications are ADHD, that is attention deficient hyperactive disorder, and OCD and autism. These are the complications, that is the condition which have been, it's like they get confused between Tourette syndrome as well as ADHD. There is they show certain similarities. So there is a diagnosis that is called as by Diagnosis Statistical Manual of Mental Disorder. This has been deciding the diagnosis. There are 4 categories. First one is they are supposed to have at least compulsory 2 motor symptoms and 1 vocal symptom. Both should be there, and it should be seen at least in 1 year. In 1 year they should have showing the symptoms. The third one is it should occur between before 18 years of age. From childhood till 18, if they are having the symptoms, then they diagnose it with Tourette syndrome, and even it should also be not caused by any substance. Like cocaine also can have certain involuntary action, so it should not, we should exclude all those things where because of any disease like Huntington disease, or because of any disease like drugs like cocaine, all these things should be excluded. Only when these 5 categories have been accepted, only then we diagnose it as Tourette syndrome. There is no other confirmatory test. The treatment is actually, there is no cure for this. As I told, after 18 years of age, in most of the patients it will get subsided. So the first one will be cognitive behavioral therapy, that is they use habit reversible therapy. That is like in case if one of the symptom like they are having any throat clearing. So when they'll have a urge, that involuntary action is going to come in their body. So they have to take certain breath, practice some breathing exercises. In that condition, they'll help to reverse the particular habit. So based on which habit they're having, they're trying to reverse it. That is what we do with CBT. It's like these are only for reducing the symptoms, like in front of everyone suddenly if they are having any involuntary actions. Only for controlling those, there are certain medications like dopamine inhibitors, so risperidone, aripiprazole, haloperidol, all these medications are given. And Botox injection will be given only for the particular muscle, so that they can help to control the tics. Only for controlling the tics, these medications are used. Antidepressant in case if there is any anxiety or depression because of the disease. For that, as a adjuvant therapy, are giving this fluoxetine. That's it. Thank you.